Good day, everyone. My name is Nation Yunus Penangolo, and for today, we're going to talk about the integral components of client care, specifically the safety. For the introduction, nurses need to be aware of what constitutes a safe environment for a particular person or for a group of people in home and community settings. Injuries are often caused by human conduct and can be prevented. Very young, learning about the environment is essential. Only through knowledge and experience do children learn what is potentially harmful. For the factors affecting safety, the ability of people to protect themselves from injury is affected by such factors as age and development, lifestyle, mobility and health status, sensory perceptual alterations, cognitive awareness, emotional state, ability to communicate, safety awareness, and environmental factors. Nurses need to assess each of these factors when they plan care or teach clients to protect themselves. Client teaching safety measures throughout the lifespan. For the newborns or an infant, use a federally approved car seat at all times, including coming home from hospital. It should be in the back seat, facing backward. Never leave the infant unattended on a raised surface. Check the temperature of the infant bath, water, and formula prior to using. These are basically a list of tips and like warnings for newborn and infants to keep away from danger. Also, for the toddler, continue to use federally approved car seats at all times. Place children in back seat when traveling in a car. Teach children not to put objects in the mouth, including pills, also like coins and all those small tiny toys. And of course, place hot pots on the back burners with handles turned inward. Keep cleaning solution, insecticides, and medicine in locked cupboards. Keep windows and balconies screened, like closed. Supervise toddlers in the tub, fence, and pools, and supervise toddlers at all times when in or near pools. Do not overfill bathtub. Do not let toddlers play near ditches or wheels. And for the preschoolers, of course, do not allow children to run with candy or other object in the mouth, like those small objects in the mouth, nose, and ears. Remove doors from unused equipment such as refrigerators. Always supervise preschoolers crossing streets and begin safety teaching about obeying traffic signals and looking both ways. Teach preschoolers the danger of playing with matches and playing near charcoal, fire, and heating appliances like stove and like rice cooker and everything about that heat appliances. Teach preschoolers not to walk in front of swings and not to push other of playground equipment. For the school-age children, these are like children from elementary. Teach children safety rules for recreational and sports activities. Never swim alone. Always wear a life jacket when in a boat and wear a protective helmet and knee and elbow pads when needed. And yeah, basically these are all the safety warnings for the school age children and tips. For the adolescents, these are basically teenagers. Have adolescents complete the driver's education course and take practice drives with them in various types of weather. Set firm limits of automobile use, namely, never to drive after drinking or using drugs, and never to ride with a driver who has done so. Encourage adolescents to call home for a ride if they have been drinking, assuring them they can do so without a reprimand. Young adults, these are people like from their 20s. Reinforce motor vehicle safety, drive defensively, use designated drivers if alcohol is consumed, routinely check brakes and tires, and use seat and shoulder belts or car seats for all passengers. Remind the young adult to repair potential fire hazards such as electric wirings. Reinforce water safety, know the depth of a pool or lake before diving. Supervise backyards, pools, and other water activities. And yeah, pretty much a list of it. And middle-aged adults, I think these are probably people that are in their 30s. And yeah, same with young adult. Reinforce motor vehicle safety, use seat belts, and drive within the speed limit, especially at night. And make certain stairways are well lighted and uncluttered. Equip bathroom with hand grasp and non-skid bath mats. Test carbon monoxide detectors, smoke detectors, and fire alarm regularly. Keep all machines and tools in good working condition at work, at home. Follow safety precaution when using machinery. Reinforce safety measures taught earlier in life, such as the hazards of excessive sun exposure. For the other adults, they've got a lot of things to keep in touch in a way. For encourage the client to have regular vision and hearing tests. Assist the client to have a home hazard appraisal. Encourage the client to keep as active as possible. Ensure eyeglasses are functional. Ensure appropriate lightings. Mark doorways and edges of steps as needed. So these are probably a lot of like tips and to protect other adults, older adults, and clinical alert. Falls can break bones and self-confidence, leading to fear of falling, which can cause a decreased activity level and decreased muscle strength. All increase the risk of falling. So it is important to assist client for fall risk on admission whenever a change in physical or mental status occurs or on transfer and before discharge. Many assessment tools to determine a client's risk of falling are available. Most assays for age, number of diseases, medications, environment, physical ability, vision, and history of falls. Assessing the client for fall risk gives the nurse information needed to develop an individualized care plan. So this is basically the practice guidelines. When a client falls, the nurse's first duty is to the client first assess for injuries, then notify the primary care provider. And so on admission, orient client to their surroundings and explain the call system. Carefully assess the client's ability to ambulate and transfer, providing walking aids and assistance as required. Closely supervise the client at risk for falls, especially at night. And yeah, pretty much a list of practice guidelines. Using a bed or chair exit safety monitoring device. For the delegation, risk factors for falls may be observed and recorded by individuals other than the nurse. The nurse is responsible for assessing the client and confirming that there is a risk of the client falling when getting out of the chair or bed unassisted. The nurse develops a plan of care that includes a variety of interventions and will protect the client. If indicated, use a safety monitoring device may be dedicated to an licensed assistive personnel who have been trained in their application and monitoring. For the interprofessional practice, assessing a client's risk for falls is within the scope of practice for several healthcare providers. For example, in addition to nurses, both physical therapists and occupational therapists assess for fall risk. Although these therapists may verbally communicate their findings and plan to the healthcare team members, the nurse must also know where to locate their documentations in the client's medical record. For poisoning and suffocation, adolescent and adult poisonings are usually caused by insects or snake bites and drugs used for recreation or in suicide attempts. Implementing poison prevention in these age groups focuses on providing information and counseling. Poisoning in older adults usually results from accidental ingestion of toxic substance or of an overdose or of a prescribed medication. Implementing poison preventions with other adults focuses on safeguarding the environment and monitoring the underlying problem. Of course, for the suffocation or asphyxiation is lack of oxygen due to interrupted breathing. Suffocation occurs when the air source is cut off for any reason. One common reason for choking is that food or a foreign object has become lodged in the throat. The universal sign of distress is the victims grasping the entire neck and being unable to speak or cough. For the client teaching, preventing a poisoning, lock potentially toxic agents including drugs and cleaning agent in a cupboard or attach special plastic hooks to the inside of cabinets doors to keep them securely closed. Unlatching these hooks requires firmer thumb pressure than small children can usually exert. Do not let children watch you open the latches. Kids learn fast, so they could probably do it without you noticing or knowing about it. Pretty much list of to prevent poisoning. These are more than 10. Client teaching. This is for reducing electrical hazards. Check cords for fraying or other signs of damage before using a appliance. Do not use if damage is apparent. Avoid overloading outlets and fuse boxes with too many appliances. Use only grounded outlets and plugs. Always pull a plug from the wall outlets by firmly grasping the plug and pulling it straight out. Pulling a plug by its cord can damage the cord and plug unit. And yeah, pretty much a teaching for to reduce a electrical hazard. And lastly, these are the practice guidelines applying restraints. Of course, obtain consent from the client or guardian. Ensure that the primary care provider's order has been provided or, in an emergency, obtain one within the time frame specified in agency policy. Assure the client and client support people that the restraint is temporary and protective. A restraint must never be applied as punishment for any behavior or merely for the nurse's convenience. Apply this restraint in such a way that the client can move as freely as possible while remaining safe. Ensure that limb restraints are applied securely but not so tightly that they impede blood circulation for any body area or extremity. Put bony prominence before applying a restraint over them. Of course, when a restraint is temporarily removed, do not leave the client unattended. Immediately report to the nurse in charge and record on the client's chart any persistent, reddened, or broken skin areas under the restraint. At the first indication of cyanosis or pallor, coldness of a skin area, or the client's complaint of a tingling sensation, pain or numbness, loosen and restrain and exercise the limb. Apply a restraint so that it can be released quickly in case of an emergency and with the body part in a normal anatomic position. Of course, lastly, provide emotional support verbally and through touch. Thank you for listening for integral components of client care, basically safety tips and to reduce and prevent danger for the client or patient.